In anesthesia, there's a number every practitioner knows: BIS 40 to 60. BIS stands for bispectral index. It's a scale, 0 to 100, that measures the electrical activity in your cerebral cortex and translates it into a single number that tells you how deeply unconscious someone is. 100 means fully awake. 40 to 60 means surgical anesthesia. The brain is deeply suppressed. The patient is under. Consciousness is for all practical purposes suspended. A BIS reading of 0 means the brain has gone electrically silent. For 24 years, Dr. Victor Chen monitored that number, cardiac anesthesiologist at UCSF Medical Center in San Francisco. He understood what consciousness was. At least, he understood it the way you understand something when you can measure it. He knew the pharmacological agents, the plasma concentrations, the specific cortical regions each drug suppressed. He knew what the EEG looked like when awareness was present, and what it looked like when it wasn't. He told me, "I spent 24 years understanding consciousness by watching it leave. I thought that gave me knowledge of both sides. It gave me knowledge of one." On a November morning in 2021, Victor was at home in the kitchen of his house in San Francisco. His wife, Dr. Ayanna Torres, a cardiologist he'd met during residency at UCSF, was upstairs. Their daughter had left for school 40 minutes earlier. At 7:14 in the morning, Ayanna heard a sound from the kitchen. Not a crash. She would describe it later as more of a controlled drop. Something going down in stages, not all at once. She came downstairs and found Victor on the floor next to the breakfast bar. Unresponsive. She checked for a pulse. There wasn't one. She called 911 and started compressions immediately. She was, among other things, the person in that house who knew exactly what needed to happen in that moment. She kept compressions going for 6 minutes until the paramedics arrived. Total pulseless time: 11 minutes and 30 seconds. When EMS arrived, Victor was in ventricular fibrillation. The paramedics intubated him on scene. They delivered 2 biphasic shocks. The second converted him. Return of spontaneous circulation at 11 minutes and 30 seconds. He was transported to UCSF Medical Center, where he had worked for over 2 decades, where the nurses recognized his face when the gurney came through the door. Victor told me he wasn't aware of any of that. He was aware of something else entirely. The first thing he described was a quality of distance, not physical distance. He was specific about this, and a man with 24 years of clinical precision tends to be careful with words. Not distance from the room. Distance from everything that had previously required his attention. The kitchen, the morning. The ordinary weight of being a person with obligations. And then he was watching. He was above the kitchen, not at the ceiling. He said the height felt irrelevant, the way it does in a dream, but more real than any dream he had ever had. He could see himself on the floor. He could see Ayanna. He could see the position of her hands, one interlocked over the other, the heel of her right hand on his sternum. And there was a detail about Ayanna's hands that stopped him when he described it. Her left thumb was hyperextended, bent back on itself in a way that looked uncomfortable, beyond the range you'd expect from compression technique. He said he noticed it from above and thought, "She's going to hurt herself. Ayanna has mild basal joint arthritis in her left thumb. It has been doing that for years." She had never mentioned it to Victor because it wasn't significant. She managed it. He saw it from above while he had no heartbeat. He also described the lead paramedic at his head, a man in his mid-30s, dark hair under the edge of his headgear, holding the bag valve mask with a specific 2-handed EC clamp grip. Proper technique, not the improvised grip of someone undertrained. He described his gloves. Blue. Not the standard purple nitrile that EMS issues. Blue. I'll come back to that. There is a gap in Victor's account after the paramedics arrived during transport and the early hours at UCSF. This is expected. The brain doesn't record cleanly when it's being reperfused after prolonged arrest. The hippocampus, which consolidates memory, is one of the first structures affected by hypoxic injury. But what Victor describes next does not come from that gap. He said, "I went somewhere." He didn't use those words at first. He built up to them. A man who deals in precision doesn't easily say, "I went somewhere," when he can't give you coordinates. But when he did say it, he said it the way people say things they have checked 100 times against alternate explanations and come up empty. It was not a tunnel. He said that word felt wrong in the way a word feels wrong when you apply it to something it doesn't fit. He said it was more like a removal of interference. The way you can hear a radio frequency clearly when you finally get away from a city. The signal was always there, but something had been in the way. There was light. He described it as having direction, which is unusual. Most accounts I have read describe light as ambient, sourceless. Victor described light that seemed to come from a specific direction. Not a single source. A direction. And whatever he was in that space turned toward it. His father was there. His father, Edmund Chen, had died in November of 2009. A pontine stroke. Victor had been finishing a case when the call came. He'd gone to the hospital, a different hospital, and arrived 90 minutes too late. He had carried that for 12 years, the specific texture of carrying it. Not quite guilt, not quite grief, the particular weight of a conversation that never happened. Edmund Chen had died at 67, a man from Guangdong province who had worked as a machinist for 31 years and expressed approval primarily through silence, through showing up and not saying anything negative about what he found. Victor's father in that space was not 67. Victor said, "He looked like no age I had seen him. He looked like himself. The essential him, not a version of him I recognized from a specific year." His father communicated without speaking. Victor is very deliberate about this. No voice. No words. Something more direct than words, which is a paradox for a man who has spent his life in the precision of clinical language and quantified data. He said, "It was the way you know something in your body before your conscious mind catches up. The way, if someone you love is behind you, you can feel the quality of their attention before you turn around." What his father communicated was this: "You are going back." Not as instruction, not as permission, as fact. And the fact was warm. The warmth was the specific thing Victor kept returning to when he talked about it, because Edmund had not been a warm man in the ordinary sense of the word. He was not cold, but tenderness was not his register. What his father communicated in that space was what Victor could only describe as tenderness. And then Victor was in the ICU at UCSF, and a nurse he had worked alongside for 11 years was leaning over him saying his name. Here is what I cannot explain as someone who spent 22 years in clinical medicine. The lead paramedic on Victor's call that morning was a man named Marcus Webb, 23 years in emergency medicine, advanced cardiac life support certified, thorough by every account. Marcus Webb used blue nitrile gloves consistently. Not because they were issued. The standard issue is purple. He had a mild documented sensitivity to the dye in the purple nitrile. Not a clinical allergy. Enough contact dermatitis to justify sourcing his own blue. Victor had never met Marcus Webb. Victor did not know that any paramedic used blue gloves. There is no reason a patient in V-fib would be told this. There is no reason anyone would mention it. When the detail was checked, by the attending who documented the debrief, and later by Victor himself when he requested the run report, Marcus Webb confirmed he had been on that call. He confirmed the blue nitrile. He confirmed the EC clamp grip, because that was how he always did it. Victor described the color of his gloves while pulseless on his kitchen floor, and the hyperextended thumb. When asked, Ayana flexed her hands and showed the range of movement in her left thumb. The basal joint arthritis has been there for years. She managed it without mentioning it because it wasn't relevant to any conversation they had ever had about anything. He saw it from above, from a position that did not exist. Now. Penny Sartori conducted the only long-term prospective study of NDEs in a ward-based ICU setting. 5 years, Singleton Hospital in Wales. Patients enrolled in advance, rather than recalled retrospectively. Of the patients who reported out-of-body experiences during cardiac arrest, she asked each one to describe what the resuscitation team was doing. Then she asked the team. Then she compared the accounts. The accuracy was not anecdotal, it was systematic, and it could not be explained by prior exposure to what resuscitations look like, because the control group, patients who had been resuscitated but reported no NDE, was asked to imagine a resuscitation and describe it. The control group made the errors you would predict. The NDE group did not make those errors. Michael Sabam found the same pattern in the early 1980s, working with cardiac patients at Emory. He compared patients who reported NDEs during arrest against patients who had not. Same age range, same cardiac histories, same level of prior medical exposure. He asked both groups to describe what a cardiac resuscitation looks like. The NDE group described specifics that the non-NDE group consistently missed. The non-NDE group described a resuscitation the way someone who has seen it on television would describe it. The NDE group described a resuscitation the way someone who was in the room would describe it. Victor Chen was in the room. Technically, he was not. The blue gloves are not something he could have guessed. The standard issue is purple. He got it right. When Victor told me about his father saying you are going back, the fact of it, the warmth of it, I didn't ask him how it felt. I recognized something in the way he said it, not the content, the quality, the way it had settled into him and stayed. I had a mentor once. Her name was Patricia. She was the senior nurse who trained me through my first year at the ICU at Providence, Portland. She taught me how to hold a chart and a conversation at the same time. She taught me that clinical efficiency and human presence were not opposites, that you could document a patient accurately and still be actually present with them in the same minute. She is the reason I learned to do this work the way it should be done. Patricia died in the summer of 2011. Ovarian cancer. She was 62. I visited her at home 3 weeks before she died. She was past treatment by then. We sat in her living room and she asked me something I was not ready for. She said, "I keep seeing things, Grace. People I used to know. Do you think that's real?" And I said what I had been trained to say. I said, "The brain does things near the end." I said it gently. I said it the way I believed kindness required honesty, and honesty required that I not let her hope for something I was trained to classify as neurological artifact. She said, "I know. That's okay." She died 11 days later. I have no way to know what Patricia found. I didn't ask her about the people she was seeing when she offered the opening. I moved on. She let me. And I have carried that conversation for 15 years, the way Victor carried the 90 minutes he spent in transit to a different hospital in November of 2009. Victor's father came to tell him he was going back. With tenderness, Edmund had never found a language for in life. And I don't know if that is what waits for everyone, or if those categories mean anything in that space, or if the warmth is specific in some way I don't have the framework to understand. But I think about Patricia saying, "I keep seeing people I used to know." I think about what I said back. I think about whether somewhere, in whatever space Victor's father occupied before Victor arrived there, something was waiting that Patricia would have recognized. I should have asked her who she was seeing. Victor Chen spent 24 years watching consciousness leave the body. He understood the mechanism with a precision most of us will never have. When it happened to him, when whatever carries him left the body the way he had watched it leave hundreds of others, he found that the mechanism was half the story at most. He said, when I asked whether his understanding of consciousness had changed, "I understand the door better than I ever have. I understand its dimensions, its materials, exactly how it operates. I just didn't know until November of 2021 that a door goes both ways. I've been sitting with that. In anesthesia, when you bring someone back from a BIS of 0, when the brain starts registering electrical activity again and the numbers begin to climb, there is a moment where awareness returns and the patient doesn't know yet that it has. They're back. They just haven't caught up to that fact." Victor says that moment, waking up in the UCSF ICU, his colleague's voice saying his name, was the strangest part of the whole experience. Not the space, not his father, not the blue gloves or Ayana's thumb. The strangest part was waking up and knowing, for the first time in 24 years, exactly what it felt like to be the one coming back. He still practices. He still counts patients backwards from 10. But he says something now, after the propofol goes in. He says it quietly, to himself, not to the patient. He says, "I know what's on the other side of here. You're going to be okay." I believe him.